Go through my pregnancy journey, we are sharing resources for pregnant women and moms, and today we're talking about urogynecology and how it can help during and after pregnancy. Dr. Sarah Evans joins us today with Urogynecology Clinic to talk more about this. Thank you so much for being here with us.
Yeah, thank you for having me and for caring about this important topic.
Yeah, of course. Throughout this series, we've been exploring all sorts of resources for pregnant women. So tell me, how can pelvic floor issues arise, and when does that start happening for many women?
Yeah, so women can start to experience pelvic floor symptoms even during pregnancy. So pelvic floor physical therapy, which we really wanted to highlight today, can help women address, for example, prevent urinary leakage, bowel leakage, pelvic organ prolapse, which we can talk about.
Yeah.
During pregnancy, it can also help address some pain symptoms that are unique to pregnancy, like new sciatic nerve pain or pubic symphysis pain. And it can help prepare the pelvic floor for childbirth to prevent, really bad tearing.
Yeah. So tell me what this therapy involves and what you guys do at Urogynecology with this.
Yeah, so when you first meet your pelvic floor physical therapist, they will do a really detailed intake assessment. So listen to what type of symptoms are bothering you. They'll do a physical exam. And then based on that, they'll make an individualized treatment program. And they use a variety of different techniques, which we can get into.
Yeah.
So for example, muscle strengthening is a really big component of pelvic floor physical therapy, and the therapists have techniques like they can use electrical stimulation or something called biofeedback to help women recruit different muscles, really maximize the strength or contractility of those muscles, and then sometimes more importantly, teach women how to relax them when they need to be relaxed.
Yeah, and making sure everything is in proper working order can really benefit your birth and postpartum. Can you talk about that as well?
Yeah, so postpartum, some women will start to experience things like urine leakage or bowel leakage, pelvic organ prolapse, which can feel like a pressure or falling sensation of the pelvic organs. New pain symptoms, like whether it's pain with intercourse or pain related to some tearing or scarring. Those are just a few of the many different things that pelvic floor physical therapists can help with.
And even if somebody has not had a baby recently, are these symptoms and signs, like, can they linger throughout, years later?
Yeah, it's never too late to seek care. Obviously, I'm a surgeon, but there are so many non-surgical treatment options available, and pelvic floor physical therapy is a really nice and low-risk way to start that treatment.
Yeah. What should some pregnant or postpartum women know about the issues, and I guess signs to look out for, especially earlier on, so they can try to catch it?
Yeah, so I think it's just important in general for women to know that pelvic floor physical therapy exists, because not everybody knows.
Yeah.
And that there's really a lot of evidence or data to support that you don't have to wait till you develop any of these symptoms before you seek treatment, that you can be proactive and prevent some of these pelvic floor disorders by doing physical therapy even during your pregnancy. And then once those bothersome symptoms do occur, that your pelvic floor physical therapist is going to offer you more than just like, this is how you do a Kegel exercise.
Right.
It's really an individualized treatment plan and uses a lot of different modalities to kind of target specific symptoms for each woman.
And I'm assuming since it is, it's low or no risk, these pelvic floor therapy sessions, right?
Yeah,
I mean, it's something that can't hurt, especially if you're having some symptoms, to try that first.
As long as you're seeing a trained professional who specializes in the pelvic floor, it really cannot cause harm. And really, whether it's strengthening or working through pain, it can be really beneficial.
And if somebody's wondering, I don't know if my insurance covers this or how that portion would work, what would they talk to their insurance provider about and say that why they would need a service like this?
Yeah, so usually this is covered just like any other type of physical therapy. So there's usually some amount of limit to the visits that are covered, somewhere between 4 to 6. But there's very rarely any pushback from insurance companies about this, and there are diagnosis codes that can be provided to help support the need for it.
That's amazing. Dr. Evans, thank you so much for educating us more on that.
Thank you for having me, and again, for caring about this.
And again, they have plenty of providers at Urogynecology, so if you're interested, we have a link on our website with all of that information. Thank you again for being here with us.